Welcome to QIC-EY Now. No opportunity wasted for making moments matter for children and youth. We're exploring the competency, use a trauma-informed approach, and we're starting right now. A trauma-informed approach recognizes that trauma can impact how children and youth communicate. Child welfare professionals need to create a safe environment for children and youth to help them feel comfortable exploring their permanency options. But what does this really mean? Let's hear an example from a professional with lived expertise.
Hi, I'm Nathan Ross, Project Specialist for the North American Council on Adoptable Children, also known as NACAC. I'm a transracial adoptee and have worked with teens and young adults within the child welfare system for the last 10 years. I was working with a colleague who had a young person that needed some tickets paid for. They got into trouble with the law, needed some tickets paid for, and those tickets kind of snowballed into this really big thing. So this young person was going to have to go to court. And the thought of going to court really stressed this client out, as it would. But the client took that stress out on the person that was trying to help her, my colleague, and so was cussing at her, was very angry at the colleague and yelling, and I don't want anything to do with you, and blah, 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 blah. And if we had looked at it from the broader system, a lot of people would have said at that point, bye. Like, you obviously aren't ready for my help. There are lots of people who need the help. Good luck. But my colleague instead took the time, was very frustrated as a human being, but didn't take it on the client, took a breath, talked to some colleagues, did some debriefing, got into some space, but then, said, you know what, I know that this isn't about attacking me. I am a stable person for this young person, and they know that they can go off the handle and they're still going to be welcome back at the end of the day. And so they are feeling very comfortable with me, and other people that have allowed this person to sever relationships by using this type of interaction. And I'm not going to do that, which was great, because then the young person called not 2 hours later. Oh, I'm so sorry. I'm just stressed. Things were going terribly for me. I really don't mean it. Can you help me? These are the things that I'm willing to do. And so just having that dialogue, the young person got their need met. And at the end of the court hearing, they came up to her and said, thank you so much, because I know that I would have been in jail had you not stayed with me. And so it's all of these things. A simple phone call, very, agitating, made us very much in our feelings, could have gone so poorly if we had just reacted as, this is just a mean person, a mean-spirited person, so we're done with them. But instead of recognizing this person has had a lot of people let her down and does not know how to manage stress and feels like she's in this on her own, even though we've told her we're going to be there, because people have told her that before and haven't been there for her. So when we take all of that into account, this outburst makes sense. And we're going to be there. We're going to address it, because we're not going to allow this to just, happen. But we're still going to be there, and we're going to see it through, and we're going to stay by our word, because that also then builds that trust piece that is really important.
Thanks, Nathan. Now that we've heard an example, let's wrap this up with some things you can do to use a trauma-informed approach right now. Be aware of your own experiences and how they might affect your work with children and youth who have experienced trauma and loss. Don't take challenging behaviors personally. Understand that trauma and loss might have altered the thoughts, feelings, and behaviors of children and youth. Focus on the child or the youth, not the trauma that the young person has experienced. Let children and youth share in their own time and in their own words what they have experienced and how it has affected them. Now is the time to have a trauma-informed approach and to make moments matter for children and youth. The QIC-EY is 100% funded by the Administration for Children and Families of the United States Department of Health and Human Services.